Dear students, I'll just show the instrument and also find out what this procedure is. See that there is a tube here which has got a flower like this, like this, flower like. And there is a trocar, cannula, everything. Look at that. So it is trocar tube with the flower for tapping the fluid from cavities. Maybe ascites, maybe pleural cavity, maybe large abscess cavity, maybe pseudocyst or cystic lesions in the cavities, maybe abdomen, thorax, or in the deeper plane, or in the legs, thighs. So different places. So what we are doing here is what is shown in this patient is ascitic fluid tap. Here ascitic fluid should be tapping. Ascitic fluid tapping should be done in the usually just below the umbilicus, right of the umbilicus pararectal area, usually right, sometimes left, depending on the surgeon's selection. Urinary bladder should be empty. That is a prerequisite, because your bladder is full, your trocar may enter the urinary bladder, you may injure the bladder, you may drain urine. So you have to confirm that urinary bladder is empty. If there is a doubt, you can pass a catheter. Then mark the point lateral to the rectus. Confirm it is dull. That's important. If it is recurrent, there is a bowel, your trocar may go into the go into the bowel. So lateral to the rectus, you have to mark the point. Then give local anesthesia xylocaine 2%, around 5 cc, skin and muscular layer, and wait for few minutes. Then make a small incision using 11 number blade, around 3 millimeter incision, and then you put the trocar into this tube. Trocar into this tube. See that it's a flower-like tube, like a malicoid catheter it is, and that perforate the tip of this tube, and through that stretch. This part is get stretched actually. This part gets stretched, and through that it enters the peritoneal cavity. Then fluid will come out. Remove the trocar. Once you remove the trocar, flower will open up, so it becomes self-retaining. So this is a self-retaining tube to drain fluid or pus or blood or clot, blood from different cavities. Ascitic tap, you drain the ascitic fluid and collect the ascitic fluid for cytology, culture, analysis, and biochemical aspects. And put a stitch and fix it with the dynaplast. And once you at one time only 1 liter can be drained. Suddenly, if you decompress more, sometimes massive acids will be there, more than 20 liters of fluid in the abdomen. If you decompress everything, suddenly phylacteric vessels will open up. Sudden cardiac input will reduce. They go for sudden rapid hypotension and cardiac arrest. Don't do that. Every 6th hourly or 8th hourly, 1000 ml, 1 liter, drain it for 2 to 3 days, because you can keep it in situ, this tube, for a few days definitely. By then ascitic fluid get drained adequately without any causing any hypotension as such. So don't drain it suddenly, rapidly, more than a liter. Only 1 liter at a time. Then after 6 hours or 8 hours you drain it. You can clamp it actually, and so that prevent further drainage. So remember about the ascites. You can read my SRB manual surgery in the liver chapter. Ascites, portal hypertension, everything is there in detail. Puddle sign, then shifting dullness, fluid thrill, tenual sign. Umbilicus is shifted one side in ascites, and black standard ruler test to differentiate between the ovarian cyst and the ascites. So you can read and find out what exactly these different tests used for ascites. And this is how exactly tube is placed. Sutures are shoelace technique. Sutures are placed. Then now exactly dynaplast is placed so that it won't come out, even though there is a flower. Make it self-retaining. So read my chapter manual of surgery, chapter 14 for that. And one has to remember causes of ascites: cirrhosis, renal causes, metabolic causes, malignancy. Even though portal hypertension is the commonest cause, nutritional, renal, metabolic, malignancy, all other causes also you have to remember and answer the MCQ. Serum ascites albumin gradient, if more than 1.1, usually suggests. So students, find out the right answer, A, B, C, D, and I'll put the right answer in the comment box. I'll acknowledge your answer also. Answer another MCQ. The pair puncture, aspiration, injection, reaspiration is done for A, B, C, D. Find out the right answer. I'll put the right answer in put it later. please put it in the comment box. I'll acknowledge your answer. And quotation of the day is, be contented, but never stop improving yourself. You should be happy with what you are having. It doesn't mean that you don't do any work, sleep. It is not so. It is, you have to improve yourself. You have to go on, keep on working, but you should not be greed. That's important. Contentment is different. Greed is different. Greed is you are asking more than what deserve. That should not be. But expecting what you deserve is not wrong. Contentment is happy with what you get it. That is contentment. Greed is you are unhappy with what you are supposed to get, but you expect much more than what you are supposed to supposed to have. So that is the greed. But contentment in the life is very, very, gives a lot of happiness. That's again very important for surgeons. Remember, so students, please subscribe my YouTube channel, SRB Surgical Insight. It has got daily brief 8 to 10 minutes lectures about instruments, specimens, X-rays, brief operative procedures, X-ray images, clinical cases daily. That is important for 8 to 10 minutes. So you can update your surgical knowledge easily without much strain, because daily small time you can spend and learn. Also share with your friends and colleagues, and press the bell and give your opinion, and also request put the answer for the MCQs, which is very, very useful, especially for students for your NEET exam, further exam, and current examination also has got MCQs. It's very, very useful, important MCQs for each slide. It is there, each lectures it is there. It also is very, very useful for you. So please subscribe my YouTube channel, and also request you to purchase my SRB Manual of Surgery, which covers all oxy, general examination, general surgery, specialties, then all breast, thyroid, peripheral vascular disease, varicose vein, then GI surgery fully, urology, neurosurgery, cardiothoracic, instrument, specimen, operative surgery, anesthesia, adjuvant therapy, a little bit oncology, with the footnote, with the quotations, with a lot of photos, illustrations, and entire topic, each topic with the management policy, investigation, treatment strategy, with a lot of illustrations. And it also follows the oxy also. It's very, very useful, cover entire subject. So I request all of you have my manual of surgery also for your regular day-to-day surgical understanding, and my clinical methods in surgery with the videos in the surgery, that will be very, very useful to understand, and clinical methods, especially in the practical exam. So every general surgery, general examination, hernia, specialties, abdomen examination, thyroid, breast, swelling examination, ulcer, then peripheral vascular disease, varicose vein examination, briefly orthopedic, and other things, everything in detail. Examination aspect is clear, lot of photos, but no management aspect. With the videos of examination of all chapters, breast, hernia, thyroid, hydrocele, peripheral vascular disease, vascular venous disease, everything. Also, it is very useful to understand before going for practical exam. So it also contains instrument, specimen, and operative procedure also. So please have my clinical methods in surgery. It will give a very good knowledge about the how to examine the patient, clinical sense, which is the pillar of the surgical surgery as such. And also have my operative surgery, go through my operative surgery through volume expensive book, which every step of surgery is minor to major surgery is given with illustration, more than 10,000 photos and illustrations. You can have it, and so that it will be very useful before going for any surgery. Before step by step, you can understand my atlas of tissue approximation, again very useful to you, and 100 pages book, atlas with the videos of tissue approximation. It will be it will guide you how to do tissue approximation, skin suturing, deeper suturing, bowel suturing, and laparoscopy suturing, everything. So it will be very, very useful. Please have it and go through it to have improve your suturing technique as such. And also again, my digital lectures through JP Publishers will be very, very helpful. It covers everything around 220 hours lectures. As for Oxy, it includes all syllabus, including clinical examination of all topics, and also operative surgery, instrument, specimen, everything it covers. So you can purchase for 1 year through JP Publishers to improve your knowledge and also face the exam as such, because it covers everything through judging our my lectures. So students, again I request you to subscribe my YouTube channel, press the bell, share the channel with your friends and colleagues, and update your surgical knowledge. And also once into a week live session through case discussion and interactions with the other than me, other few other senior faculty will be there to help you understand the practical examination and how to face the exam, how to examine the cases, how to discuss the cases. And also, if you attend live, you get a certificate which is very useful for your future career as such. So, students, I hope you understood this lecture very well. Thank you so much.